All right, Matthew Holt, the big question of the day, VIVE or HIMSS or both? Ugh.
Or neither.
Hey, that's the way to do it. It's the March 3rd episode of Health Tech Deals.
So Jessica, I thought the big question was, State of the Union versus invading Ukraine versus, no, it's all about VIVE versus HIMSS.
VIVE versus HIMSS.
Well, I'm going to VIVE. I think you are too.
Going to VIVE.
All right.
Are you going to HIMSS?
No, first one I missed in...
Well, you were banned last year.
I don't think I've officially been banned. The person who said I was going to be banned is
no longer working
now quit, so who knows? But the interesting thing is, HIMSS says, according to his stock, HIMSS says they've sold, nearly 1,000 booths, which is about what they were going to do. VIVE seems to be quite busy, quite hard to get a hotel room, especially if your Airbnb cancel on you because of COVID.
Right.
Yesterday, as mine did, I may be sleeping on the beach.
Which is, I think, just like a falsehood because there is no COVID in Florida.
Yeah, COVID apparently is over. It barely, it kind of got a mention in the State of the Union, but kind of. And, we're going to have more testing and pills and it's all good and we're all fine. And apparently it's it's prevalent both in Ukraine and rampant in the Russian army.
But not in Miami.
Oh, I'm sure there is no COVID of any
except
disease
for the one person who's got
Florida.
it, who has your Airbnb.
Well, there is that. And then we'll find out. I think people are going to be a bit surprised when they get a VIVE and they're going to have to get tested.
Yeah, you have to get COVID tested. Don't forget. So make sure you build that into your morning. Yeah.
We shall see.
All right, set your timer. Let's do these deals.
All right. Yeah. So we have the kind of motley pre-conference deal selection.
Yeah.
But you'll see what we got.
Right.
Okay.
Ready?
And go.
ModMed acquires Klara for $200 million. Matthew Holt, what do we know about this?
Yeah, $200 million is the rumor in his talk. So ModMed is kind of like a specialty EMR that does a whole bunch of stuff like urology, and they've been at Health Tube once or twice. Klara, way back, it's like a communication system, one of these other ones like Tiger Connect or maybe Tendo or whatever. Way back when Health Tube gave them some money for a grant for New York City. I want my 10%. So Klara had raised about 30 odd million. ModMed raised another 54 as part of this. They've raised about 400 million now. I don't know, 200 million I suppose in stock is decent for probably out of a, probably a $2 billion valuation for ModMed now.
All right, what do we know about Nayya? They raised 55 million, brings their total up to 106. This is like a benefit selection tool, transformations in this and iconic growth.
Yeah, I mean, who the hell knows? It's a new company. I mean, they raised a lot last year. They've now raised 106 million overall. And I guess benefit selection has been a pain in the ass and very difficult for many years for employers. I'm surprised that, you could build that big a company in this area. This, by the way, is where Healthion was going to be in 1996. So things haven't changed very much.
All right, how about this interesting partnership? Sanofi partners up with Dario Health to bring chronic condition DTX to market. $30 million, $30 million deal, multi-year partnership. Matthew Holt, what do you think?
Well, Dario is pretty small, right? They're only doing about 15 million a quarter, so a $30 million deal is pretty big news to them. They're publicly traded, kind of a weird company. They do a bunch of stuff, starting with diabetes, other stuff. Sanofi, of course, was originally involved in Onduo with Verily, now not. It's kind of like two orphans finding each other. I don't know what's going on there.
All right, what about Roe? They acquired Dadi, which is an in-home sperm testing company.
Spray and pray.
Matthew Holt. All right, moving on. Daybreak Health. This is mental health for kids who are going to need it right now after that comment. They get $10 million in a Series A. This one is mental health for kids been successful via schools, right?
Yeah, actually, it's quite interesting. There's I run into a couple of these who are targeting schools. There's another one called Neolf, and I saw one at the What If Ventures session night, which was raised a couple of million, and it was raising a couple of million and had raised it. And I'm blanking on the name, although I did talk to the CEO. But basically, there's a whole lot of money.
Is that the one named after the animal that I thought was supposed
no,
to be
that's Little Otters.
Little
so
Otters.
Little Otters. Okay, so Little Otters and Brightline are kind of networks of child psychologists, child psychologists aimed at kids via employers.
Okay.
Brightline. Naomi Allen is I have an appointment with them earlier today. They are very busy. They have a lot of employers lined up for their employees' kids. There's a separate big bucket of money that came out of the CARES Act and some of the infrastructure. I don't know where it came out of. There was a big bucket of federal money.
But there is a bucket of money.
A lot of money. A lots of money, which is aimed at mental health for kids in schools. In fact, that got a mention in the State of the Union as well.
Yeah, it did.
And I think that a number of these companies, including I mentioned Neos, but also Daybreak and others, are aiming at that bucket of money.
Okay.
And they're going to go. There's a company called Hazel Health, which does general healthcare in schools for school nurses, telehealth stuff, which is also got a mental health component. So I think that's another way people are saying, well, there's all this money in schools. We need to figure it out. Can we go and provide mental health services for kids? Daybreak Health is somewhere in that thing. Interesting enough, they have the same name as one of the tools of your friends at Big Health. So somebody will be suing somebody.
No, they're not, because that's Daylight.
Sorry, Daylight.
Because I've messed that up multiple times. No, Daylight. There's Daylight and Sleepio for Big Health.
Okay, but they're not mental. Well, they're kind of mental health.
Yeah, it's anxiety, but not for kids. People, name your companies different things.
Wellness, health that.
Doctor.
Doctor,
anything. Right. Oh, we could go on.
Right.
Yeah. Anyway, let's get out of this.
Okay, well, we're going to be in Miami. The next time anybody sees us, there will be the odd interview.
Oh, the odd interview. There will be the odd health tech deals episode from somebody's booth somewhere. There will be. Hey,
you want us to come do it in your booth? And better write a huge check for the privilege?
Pay up for it.
Yeah. You can come.
Guest starring.
That's it.
Yeah. Okay. So to send those checks, reach out to us on Twitter. We'll send you a mailing address. I am over there at Jess DaMassa, and he is at Bolty Boy. And of course, follow us to follow along with the fun that we're going to have on the ground in Miami at VIVE. And to make sure that you don't miss an episode of anything that's recorded in any booth there or anywhere else, sign up for the email newsletter over there at thehealthcareblog.com and receive the best of the blog delivered directly into your inbox every week.
Also
what?
No, it comes every week also. I didn't do it
last week. Not
do it last week because I was sick. I will do it next week.
If you want to sponsor subtitles, we're looking for that too.
Also.
It sounded the same.
Talking about mental health for kids, my kid is in speech therapy because he can't say his R's properly.
I wonder where he got that.
Perhaps I could join. All right.
All right, that's it. We're done.
Bye.
Enough of the problems. We'll see you guys later. Bye.